Hello, I'm Dr. Ross Walker, and I'd like to talk to you today about the 5 keys to ultimate health. And this is in increasing order of importance. Number 1 is to have no addictions. You cannot be healthy and smoke. So anyone who smokes, whether you're a 25-year-old who can run a marathon, you are still unhealthy because you're smoking. You cannot be healthy and drink too much alcohol. So it's okay to have maybe a glass or 2 of alcohol, red wine with a meal, whatever, but it's not okay to consistently have 3, 4, 5 per day. You cannot be healthy and use any illegal drugs. So quit all addictions, that's number 1. Number 2 is good quality sleep. 7 to 8 hours of good quality sleep per night is as good for your body as not smoking. And I say to all my patients, all my friends, I do this myself, go to bed at the same time, wake up at the same time. Sleep in a cool, dark room, and another great hint there, get rid of all electronics out of your bedroom. The bedroom's for 2 things. It's for sleeping and for that wonderful activity some of us get to do before sleeping, for nothing else. So, good quality sleep. Number 3 is nutrition. Now, nutrition is easy to talk about, harder to do. Basically, it's called eat less food, eat more natural food. And I hear all these things about these new fad diets, whether it's paleo or being vegan or whatever, and I've got no problems with them. But the reality is the only diet that has any evidence base whatsoever is the Mediterranean diet. The Mediterranean diet has been studied for many years with wonderful data about the benefits of being on the Mediterranean diet. And what's the Mediterranean diet? It's nothing magical. It's basically having 2 or 3 pieces of fruit per day, 3 to 5 servings of vegetables per day. And a serving's about a half a carrot. So we're not talking about a huge amount. And you'll say, well, that's okay, Doc. That's easy. Well, if it's easy, how come less than 10% of people have 2 or 3 pieces of fruit per day and the 3 to 5 servings of vegetables per day? And the people who do that have the lowest rates of heart disease and cancer in the community. So nutrition is very important to base it around fruit and vegetables, but then if you like, little bits of meat, eggs, dairy, chicken, fish, nuts, olive oil. There's your Mediterranean diet. And the studies show very clearly that following a diet like the Mediterranean diet reduces your risk for heart disease, cancer, Alzheimer's, chronic kidney disease, a thing called metabolic syndrome that we'll discuss in another podcast, by around 30%. So diet is very important. And it's number 3. Now number 4, which I call the second best drug on the planet, is 3 to 5 hours every week of moderate exercise. And when I say moderate exercise, I mean exercise where you feel a bit tested by the exercise, what we call perceived exertion. So perceived exertion is when you are exercising, you break into a bit of a sweat, you feel a bit short of breath, but you can still hold a conversation with another person. So we're not talking about to the point where you're really gasping for air and the sweat's pouring off you. If you get to that point of moderate exertion, so perceived exertion, that reduces your risk for 3 to 5 hours per week, reduces your risk for heart disease, cancer, Alzheimer's disease, depression and diabetes by 30%, reduces your risk for osteoporosis by 50%, it drops your blood pressure and you sleep better. There is no pharmaceutical drug known to man that's as powerful as exercise. And there's only one thing more important than exercise. The most important drug on the planet is a thing called happiness. And people who are happier have less disease than people who are unhappy. And when you are happy and you have a problem, you get better quicker from the problem by being happy. And interestingly, there's a 75-year study from Harvard University that showed the one key to health and happiness is to have someone else in your life who loves and cares for you, who you love and care for. Much more important than your damn cholesterol levels. So what I'm saying to you, if you practice those 5 keys of being healthy, no addictions, good quality sleep, good quality eating and less of it, regular exercise, 3 to 5 hours per week, and most importantly, happiness. The studies show you reduce your risk for cardiovascular disease around 80% and other diseases around 70%. So see the 5 keys of being healthy as the most important part of any sort of health program you're involved with. Thank you.